This morning, Tennessee has confirmed its first measles case this year during the ongoing nationwide outbreak. Jaxie Pigeon joins us in studio with details from state health officials.
Well, Peyton, the Tennessee Department of Health shares the person infected lives in Middle Tennessee, but did not tell us which county that was. Officials say the patient first got sick in early March and is currently recovering at home while the health department works to determine the source of the infection, as well as identify others who may have been exposed. This case comes as the country faces a measles outbreak with more than 350 cases, majority of which have been reported among unvaccinated people in Texas and New Mexico. Shandy Dirth with the Fairbanks School of Public Health says measles is a respiratory disease that spreads through the air and by touching contaminated surfaces. She explains that symptoms typically appear within 1 to 2 weeks after a person has made contact with the virus.
You can spread it before you have any of those symptoms. And it's so contagious, it can stay in the air for a couple of hours after you've left the room. So if you have unvaccinated people in a room with someone with measles, 9 out of 10 unprotected people can actually develop measles from that exposure. So you really want to make sure that you've got your 2 doses and that your children have their 2 doses.
The State Department of Health says measles typically begins with a red spotty rash on the face that spreads over the body. Additional symptoms can include fever, cough, red eyes, or congestion. Health experts say the best way to avoid measles is to get the measles, mumps, and rubella, or MMR vaccine. The first shot is recommended for children between 12 and 15 months old, and the second between 4 and 6 years old. Peyton.